Are prednisolone eye drops safe? Prednisolone eye drops are a form of corticosteroid medication commonly prescribed to reduce inflammation and treat certain eye conditions. These conditions may include uveitis, which is inflammation of the middle layer of the eye, allergic conjunctivitis, inflammation due to eye surgeries, or other types of eye inflammation. Generally, prednisolone eye drops are considered safe when used as directed by an ophthalmologist or healthcare provider. However, like all medications, they can have potential side effects and risks, especially if used for prolonged periods or not as prescribed. Some potential side effects of prednisolone eye drops include increased intraocular pressure, IOP. Long-term use can lead to glaucoma or worsen existing glaucoma, which is why patients using these drops are often monitored for changes in eye pressure. Cataract formation. Prolonged use of corticosteroid eye drops can lead to the development of cataracts. Delayed healing. Steroids may slow down the healing process of the eye after injury or surgery. Infection risk. Steroids can suppress the immune response in the eye, increasing the risk of bacterial, viral, or fungal infections. Eye irritation. Some people may experience burning, stinging, itching, or redness when using the drops. It's important to use prednisolone eye drops exactly as prescribed. Overuse or misuse can exacerbate side effects or lead to complications. Patients should be regularly monitored by their healthcare provider while using these eye drops, and any unusual symptoms or side effects should be reported immediately. For example, a patient who has just undergone cataract surgery may be prescribed prednisolone eye drops to manage postoperative inflammation. In this case, the eye drops would be used for a specific duration and the patient's recovery would be closely monitored to ensure that the eye heals properly and no adverse effects occur. If you're prescribed prednisolone eye drops, your doctor will consider the benefits and potential risks in your particular case. It's critical to have open communication with your healthcare provider about your medical history, any other medications you're taking, and to follow their instructions to ensure safe and effective treatment.